Hi, this is my week 14 reflection regarding mental disorders and substance abuse disorders. So what surprised me this week is that 21 to 29% of patients prescribed opioids for chronic pain misuse them. I realized this number is pretty high, but I didn't realize it was that high. I think, over a quarter of them is a pretty significant amount of people misusing pain medicine. What did not surprise me is that since 2017, there's been an increase in deaths associated with legal and illegal fentanyl. I think whether it's people I've gone to high school with who have had issues with addiction or patients that I've seen come in, a lot of times we find what they think is heroin, we actually find fentanyl in their system, and a lot of these deaths are accidental, and we attribute a lot of them to fentanyl. 3 things I learned about mental disorders this week is that schizophrenia development may be linked to perinatal complications or viral infections during pregnancy. I had no idea that environmental factors had any play on schizophrenia. I always felt that it was either a genetic mutation or passed on through genes through families. Major depression is also referred to as unipolar disorder. I guess this makes sense when you think of bipolar disorder, but I had never heard of that term. Large doses of anti-anxiety agents can cause ataxia. I always just look at anti-anxiety medications as suppressing agents, and the fact that it can cause kind of twitching or involuntary movement is kind of surprising to me. 3 things I learned about substance abuse disorders are substance abuse is also referred to as chemical dependency. I always felt that substance abuse was simply any sort of misusing, whether it's alcohol or cocaine or heroin, versus chemical dependency. I always attributed that term to be more of that physical or psychological dependence on it. I didn't realize that they were quite literally the same. The WHO estimates that every $1 spent on substance abuse treatment, there's $7 saved in healthcare related spending. I think this is a significant number in the long run. I also didn't know that methamphetamine is also referred to as crank. I've never heard that term before. I've never heard of meth being referred to as crank. So implementation for me, especially because I see myself working in hospice in the future as an MP, I think is significant. I think that there's a lot of misuse, particularly in the palliative side of things. People who have chronic pain managed with opioids. I think it's important for me to be able to understand what addiction looks like and being able to identify those patients who might be misusing medication and being able to tactfully approach that. In hospice, I've been asked before, family members have been concerned about their family member becoming addicted to methadone. We use methadone a lot in the hospice company that I work for, and a lot of them kind of get freaked out. They're like, oh my God, methadone, that's like what drug addicts use when they're trying to wean off of heroin. And so some of them kind of freak out about it, and then others kind of panic that they're afraid their family member is going to become addicted to it. And it's really hard to, again, being tactful in hospice is really important. I think, being tactful in healthcare is really important, but especially when it comes to being able to approach discomfort at the end of life and not being so insensitive where you're like, well, they're dying anyway. So having that ability to educate these families on the fact that, at this point in life, it sometimes takes a lot of medication to get people comfortable, and really becoming addicted at that point is pretty impossible. Versus the palliative side, it's definitely possible. Those people aren't considered terminal just yet, but they do have chronic conditions that might, be causing them chronic pain. So, what else can I say? I just think it's this, not only just substance abuse disorders, but mental health disorders are very common with chronic patients and terminal patients. Anxiety and depression are both particularly two that we really try to hone in on and try to assess those symptoms in patients. It's part of my daily assessment to make sure that they're not feeling anxious or depressed and being able to treat that, because it is considered discomfort. And it is really common for these patients. So, and I think that's it.